Ready? Thank you everyone for coming here today. We announced this press conference to talk about the important changes that will occur in Tennessee as a result of the congressional act called the AHCA to change the health insurance that we provide in Tennessee. My name is Julie Byrd Ashworth, and I'm the Democratic candidate for the House District seat in Collierville, Germantown, and Eads. The election is Thursday, June 15th. I have with me Dr. Don Nielsen, who will tell his personal story in a moment of how the Affordable Care Act saved his life. I also have John Ashworth, my husband, behind me, who will also give his personal story. But first I'm going to let you hear from Matt Myatt and Carly Hutchinson with the Helmsley and Associates group. Helmsley and Associates Consulting Group, who provide mental health services here in Collierville, and they can tell you their personal stories with clients as well. Matt and Carly?
Hi, thank you, Julie. My name is Matt Myatt. I'm with Helmsley Consulting and Associates. I'm a counselor. I have my master's from the University of Memphis.
And I'm a licensed professional counselor here in the city of Collierville.
Just wanted to talk a little bit about the opiate epidemic. Across the country, a lot of deaths that are occurring, but this is happening here in our community in Collierville. Over 1,400 deaths last year in 2015 alone, which has surpassed motor vehicle accidents. 72% of all these overdoses involved opioids. As a counselor and a person in recovery, this is something that's close to my heart. I've seen many people recover and change their lives, and if one person can recover, it affects the whole family and promotes their growth to be a productive member of the community as a whole. Access to evidence-based treatment is the first step for a person to recover. Going into treatment, having access to that care, and then working a life of recovery promotes this lifelong growth, and again helps them to be a productive member of our society. Most of us have a loved one or somebody that we know has been touched by this. Here in our community alone in Collierville, we've seen deaths related to this epidemic. We're not insulated from that problem. By providing access to quality treatment, we can change one person at a time. This change not only benefits the individual, but the family and the community as a whole. The cost to the community, when you have people suffering from addictions, can increase crime, then also getting people back to being this productive member of society. It benefits the community as a whole. Relapse is a part of recovery sometimes. It doesn't have to be, but a person that has a relapse could be prevented from going back into treatment if the healthcare legislation is not passed in order to give them access. It could be perceived as a pre-existing condition. Julie is a really big advocate for treating with persons with addiction, and she's going to fight to ensure this coverage continues, and this is going to benefit us here locally in Collierville. I appreciate your time and the opportunity to talk about these issues, Julie.
Thank you. Carly, do you have something you want to say?
Sure. So just talking a little bit as far as statistics, 1 in 6 typically we see in Tennessee have experienced misuse of opiates. On average, you're looking at the age of 14 as the onset of experimenting. And as Matt said, we're looking at over 1,400 deaths in 2015. More than half of individuals who use opiates start off with finding it with their family and their friends. And the city of Collierville actually recently did a no questions asked drop-off to dispose of any narcotics, which I think would be a great opportunity to continue to prevent more overdoses in our community. Our community needs more support rather than judgment. There's a lot of fear going in and obtaining help, and that's something that definitely we need moving forward. And the accessibility of opiates is generous and it would benefit from a reduction with more access to naloxone, which is an opiate blocker. It would actually save more lives and prevent family members from passing away. And one thing is that, to be honest, every person in our community has been affected by the opiate epidemic, and I definitely think that we need more support and resources out there.
We in the legislature need to provide that for you. Thank you so much. Is that all? Great. Now I want to hear from Dr. Don Nielsen, who's going to tell you his personal story. Don, you're going to walk on over here.
All right.
And he can tell you how the Affordable Care Act saved his life. Thank you, Dr. Nielsen, for being here.
Thank you. 2 years ago, my wife and I hung up the phone, and we didn't know what would happen. 2 years ago, I would 2 years ago, I was I don't know.
You had a stroke.
A stroke, and 2 years ago I need care, and
You needed health care.
yes, I need health care
That's okay.
with the AHCA. With the ACA, I was fortunate enough to have coverage, but with the
Pre-existing condition?
yes, very existing condition, but with the AHCA, who knows, might not have any conditions. Well, Julie and Julie and fight for justice, coverage, and Tennessee I might not have to worry about you.
You're worried about keeping your Affordable Care Act coverage, aren't you?
Yes,
And
I know.
as a result of the stroke, you were alone for about 20 hours before
20,
they found you.
yeah.
24 hours.
Yeah.
And when they found you, you had a lot of recovery.
Yeah.
As a result of that, you lost your employer-based health insurance,
Yes,
right?
yes.
And you had no insurance to provide for your future treatment and your recovery except what was provided through the Affordable Care Act.
Yes,
And
thanks.
that's okay. You and your wife also were forced, as a result of you losing your job because of your stroke, to move in with your daughter and son-in-law
Yeah.
here in Collierville, correct?
Yes,
And you are now proud residents of the city of Collierville.
yes,
Okay,
thanks.
I'm not trying to put words in your mouth. Okay.
No.
Okay. And you have a PhD in applied behavioral science, correct? Applied behavioral analysis.
Yes.
Got it. Okay. Thank you so much for
Thank
telling
you.
your story, and we're going to do everything we can to make sure you continue to have the ACA coverage.
Thank you.
Thank you. And now we also wanted to hear from John Ashworth, my husband, who also his personal story that he wants to tell you about how the Affordable Care Act has made a difference in his life. Wes?
Hi, I'm a civil engineer and a land surveyor. Been working hard since I was 13. Professional engineer, professional land surveyor licensed. During the recession, I had to go to work for another company to obtain affordable health insurance because I'm diabetic, through no fault of my own. So when the Affordable Care Act came along, I was able to actually get coverage because I was uninsurable prior to that, and I reopened my business. For about 3 years now, I've been working for myself again. And if I lose the ability to get insurance through because of my pre-existing condition, then I'll either have to go uninsured or I'll have to go find work for another company. I just don't see where that's right. So thanks.
It means that your small business would no longer be a small business and you
correct.
won't be self-employed anymore.
That's correct.
Same as me. Thank you, Wes. I
You're
appreciate it.
welcome.
My name is Byrd Ashworth. I'm the Democratic nominee for the State House District 95. The election is June 15th, Thursday, June 15th, and the polls are open from 7 a.m. to 7 p.m. The reason you've heard these stories today of mental health professionals that provide care of two people who the ACA has actually helped and saved in certain respects, it's important. You may wonder why what's happening in D.C. and in Washington about the AHCA affects us here in Tennessee. Let me tell you why. The proposals in Congress that have been passed by the U.S. House of Representatives would then move to the states to define what the essential benefits that every health insurance policy written in the state would provide. The AHCA, as it's called now, would, if passed by Congress, would also allow to the states to grant waivers and exemptions for certain healthcare items to be covered. The reason it's important to elect your state House representative with this in mind is this. The next person that goes to Nashville that represents Collierville and Germantown will be making decisions about these essential benefits, about whether pre-existing conditions will be covered, about whether 500,000 people will lose their health insurance if the Insure Tennessee is not expanded. The reason this is important for the citizens of Collierville and Germantown and Eads is because self-employed people like my husband and other people who just can't get health insurance can get health insurance and provide coverage for themselves and their families. As Matt and Carly also provided, 1,400 people died in Tennessee in 2015 as a result of an opioid overdose. As I've already mentioned, 500,000 Tennessees will stand to lose their health insurance coverage. If the states are then allowed to make the decisions about health care insurance, the next legislature that goes into session in January may vote to grant waivers to allow health insurance companies to charge people with pre-existing health conditions more. It will also potentially exempt insurers from providing those 10 minimum essential benefits, which includes substance abuse coverage. Moreover, what's happening in Congress will also allow the states to define that anybody who's been treated for a substance abuse problem in the past will necessarily be automatically having a pre-existing condition. We already know how the Republicans in the state House will vote on this. We already know that the Republicans in the state legislature would rather have 500,000 people without health insurance, would allow the Insure Tennessee promoted by Governor Haslam simply not to go into effect. We've had 8 rural hospitals close in the state as a result of the failure to accept the expansion of the Medicaid program. $3 billion have left the state, money that should stay in the state of Tennessee. They have left the state and been spent to other people. The Republicans in the legislature need to think about the citizens of the state of Tennessee when they make decisions. I promise you that I will. Byrd Ashworth, please vote for me on June 15th. And thank you for your time today. And thank you, Don and Wes and Carly and Matt. And have a good day.